Hello, everyone. Welcome to this masterclass for critical thinking. This is the topic that is absolutely a must know for your US licensure examination. And I'm happy that you are joining me so that we can discuss how international nurses should approach critical thinking. So this is going to be a great class. Get out your workbooks. If you have your V2 student workbook, if you're a part of the V2 program, go on and get even that book out, because this is going to be added as one of the big topics. You know, we have to change how you think when we discuss critical thinking. Did you know that? Did you know that the way that we begin nursing school and how we think at the beginning of our nursing school education does not serve us at the end of our nursing school education? So, we have a work to do. But luckily, if you're in the ReMar family, then you know we have an amazing partnership with Kenyan Nurse Consultants, and they are going to make sure that you have everything that you need, not only to understand the process of coming to the United States to work, but also so that you understand the process of how to pass your NCLEX and how to get an amazing job. So we have all of the bases covered today. As you are coming in, just let me know where you're from. Just let me know where you're from. This is a class for international nurses. All are welcome. We all can strengthen our understanding of critical thinking. But we know that international nurses are bringing something so special to the United States when they come, and that is the culture, that is their language, that is their understanding of how to care. So yes, Haiti is here. Okay, I see that. I did enjoy Haiti very much. Traveling around and meeting everyone. South Africa in the house. Mary from Kenya. We have Mombasa. Oh, the beaches in Mombasa, the humidity in Mombasa, so good. All right, Kenya in the house, Nigeria, England as well. Welcome all. This is the critical thinking class. So what I'm going to do is I'm going to bring on my co-hosts for today. I have two great co-hosts for today. I have, you guys know, the president of ReMar. Mark is here, and I want to bring him on so that we can start by saying a little prayer for today. Would that be okay? Would you allow him to come on? So I'm going to bring Mark on as we prepare for this amazing class. This is Critical Thinking for NCLEX, a hands-on approach. Welcome, Mark. Welcome. How's it going? I can't, it's a little mute. It's on mute.
Regina, everything is amazing. I'm so glad to be here with you and the ReMar Nurses. Also to be joined by Paul Simiyu, Managing Director of KenyanNurse. We are here for an amazing purpose and to just plant some seeds that are going to grow into something fantastic and something great. And so we're going to say a little word of prayer. We're going to say a big word of prayer because we serve a big God. And just seeing everybody come into the room is just so amazing. When you first got on, I think there were only maybe about 40 people, and then it jumped up to about 100, and now it's around 150, 160. And it's like the room is just getting bigger and bigger and bigger because this is a major event and helping nurses from all across the globe, and particularly the continent of Africa, to be able to get what they need to come to the U.S. and live out their nursing dreams using the skills that God has given them. Before I pray, I just want to say on yesterday, we had an amazing message when we went on church, and he talked about from Luke chapter 5, where is the story of the paralytic man who was brought to Jesus in a crowded room, and he was brought to him by four friends. So like the guy was paralyzed, and the story says that Jesus was in the city and he was teaching, and the place where he was, it was kind of like this live. People were just packing in. And so the friends, they couldn't get through the door. They couldn't get through the window, but they were determined to get help for their friend by any means necessary. And so somebody said, let's go in through the roof. So they climb up to the roof, they take their friend with them, and they start breaking up the towel and pulling back the covering of the roof, and they end up lowering their friend down. The four men, they peek their head through, and they see Jesus at the center of this place, and they lower their friend down on this mat and place him at the feet of Jesus. And so this is something that I'm seeing here with everybody shouting out where they are, where they're from. And I see that there are a lot of friends here. There are a lot of people that have tagged their friend and said, hey, listen, something is going on over here. You have to be a part of it. And so I want to encourage you that you have to find your place. You have to get in where you fit in, or make room for that blessing, for that miracle, and be persistent about it. And so at the end of the day, that's where we should all find ourselves, is fighting to be at the feet of Christ, to be at the feet of Jesus, so that we don't miss whatever blessing that he has. So as the story goes, the man was paralyzed. They lower him down into the room at the feet of Christ, and everybody's looking. And there's some people are doubting. They're saying, I don't know, like what they're doing. He's saying that he's going to heal this man, and I don't know if he's actually healed. And he says their sins are forgiven, and Jesus is just pouring it on to this guy. He's blessing him, he's healing him, he's forgiving his sins, and he does this. And the Bible says it only mentions him, this one guy, out of everybody that was in the room, as getting that particular help. Like just the one person in a room full of people. And so right now we're looking at a room of 199 individuals. And what a shame it would be if only one person took advantage of the opportunity before them. So listen, guys, we want to move by faith and not fear. Right? This is a long journey that you're planning. Some of you need financial healing. Some of you need mental, emotional healing. Whatever that is, it is here in the room, because we believe that with God, it is possible. So we're going to say a prayer. We're going to say a prayer that everybody in the room, not just one, but that everybody in the room is going to have the faith to receive whatever it is that they need on today. And it might even be the forgiveness of your sins. And certainly that would be you and I, because we die daily. We die daily so that we may live through Christ. So let us pray before we do anything else. Let us go before the throne of grace. Our Father and our God, we thank you for an opportunity to simply say thank you. We thank you, Lord, for being a provider. We thank you for putting a vision in the hearts of the ReMar nurses. We thank you, Lord, for giving them intelligence and wisdom and provision to be able to seek out that which is your good and perfect will for their lives. Lord, I ask also that you would forgive us of our sins and our shortcomings. Forgive us, Lord, for not coming to you first in every situation. I ask, Lord, that as the nurses plan this journey, this voyage overseas to the United States, Lord, that you would make the path clear for them, that you would make the way straight, and that you would provide people and resources to help guide them into where they need to go. And these blessings I ask, Lord, if it is your will, in Jesus' name I pray, amen. Amen.
Amen. Amen. Thank you. Thank you, Mark, for that wonderful message. Let more than one in the room get the help that they need. Oh, I love it.
Absolutely.
Thanks, Mark, so
Don't miss this opportunity. God bless.
All right. Thank you. We are going to be now introducing a major blessing to you. It is the managing director of Kenyan Nurse Consultant, the one with the keys, the one who has done it before. He has walked the path successfully to what you're trying to do. And let's welcome the managing director, Paul Simi. You can't forget the RN. Hello.
Hello, Prof, and thank you so much for welcoming in this wonderful session. As you've said, we can't forget RN because I'm a registered nurse in Kenya, and I'm also registered in the United Kingdom. And for any nurse who is here looking forward to commence their journey to the US, you're in the right space, because we are here to work together with Professor Regina to ensure that you do not just have the knowledge, but you have the way on how to achieve your dream. Because we understand that wherever we train, wherever we're working, we're so much knowledgeable. But the difference that has actually been brought is that information, that resources, that ability to be able to ace this NCLEX exam on your first attempt. Kenyan Nurse Consultant Limited, in partnership with Professor Regina, are here to enable you be able to prepare this NCLEX exam and pass on your first attempt. And KenyanNurse comes in with the consultant skills to enable you to process this journey within 6 months. And our partnership enables you to become a USRN in just 6 months. And it's really something that most people are surprised to actually understand that this is doable in this current period of time. And it's possible because so many nurses have been able to do it even within 4 months. We are working with 4 to 6 months. You become an officially licensed nurse to be able to actually secure jobs in the US. This 6 months doesn't require you to have IELTS. It doesn't require you to have OET, TOEFL, or even experience, because with the process on how you can become a USRN is a process for newly qualified nurses. It's a process that doesn't require the IELTS, because IELTS will be required at the next stage, which is the visa screening purpose. So with this, it means you only need to have the dream. And I believe wherever you are, you have that dream. And you know colleagues who have those dreams. If you are in this forum and you know any other colleague, any other friend, any other nurse, either in Kenya, Nigeria, Ghana, Sierra Leone, Zimbabwe, Uganda, without forgetting Tanzania, Ethiopia, and also Rwanda, if you know a nurse who has a dream, who do not have IELTS, who really wish to be a USRN and is not with us here, you can share the link that you are just using to actually watch us and listen to us, to those friends of ours, so that we can be able to also share this good news. Anything news that is so good, we really need to share with our friends. And as nursing is caring, sharing is caring. Bring them on board. Let's have this conversation. Let's hear this sweet message from Professor Regina, so that we are able to work together as a family. We are able to work together as colleagues and as communities. So let's use these 5 seconds. Share the link to your colleagues. Tell them to join us so that we are all in this wonderful session. Please bring them on board. And as you continue to bring them on board, allow me to break down on how you can be a USRN in 6 months before I bring in Professor Regina to make this NCLEX as easy as possible, because each and every NCLEX question requires you to have critical thinking, requires you to apply the critical thinking skills. And Prof is here to make it so simple the way she does it. And the way she does it, I don't know. She simplifies these NCLEX questions, approaches, and you feel like you need to do even this exam tomorrow. So she's here to make it possible for you to pass on your first attempt. Welcome, and I hope at the end of this session, you'll be blessed to be able to pass this NCLEX exam, because you must and you will pass NCLEX. So most nurses who have been processing this process with other agencies have been taking actually the longest period, some even 5 years, some even 6 years. I know of colleagues who we started processing together. She was processing for US and I was processing to UK. And right now, I've stayed in the UK. I've become a permanent resident in the UK while she's still processing. I want to understand why and how some nurses are taking so long in the US process until it scares so many nurses. And some of these agencies are so reputable. They are so popular. They are actually big agencies. But let's try to learn some tricks that you, as a nurse, you can actually learn to benefit and be able to maneuver through this process. So some of these recruitment agencies are somehow responsible for some of these delays, as we're going to actually break down step by step, me and you, wherever you are. In total, these agencies are fully responsible for close to 24 months, that is close to 2 years of your delays. And this hurts so much. And that's why KenyanNurse is here to empower you, to bring this power back to your hands. And you are going to understand how these nurses are actually delayed at each and every step. If you are able to look at the screen, you notice that the first point is most of these agencies are actually taking enough time to review your application. By the time you make your application, they can take 2 months before your application is reviewed. And that takes time. That causes you more delays without you understanding. You've made an application, no response, 2 months, 1 month, that is delaying you. These agencies will also put you on queues. You remember they are receiving applications from all corners of the world. They are receiving applications from Kenya, Uganda, Philippines, India, and so forth. So once they receive your application, they're going to put you on queues. The time you start your CHFNS, actually 2 months has elapsed. By the time you go to actually NCLEX training for you to start being paid for the training, time has elapsed. By the time you start your State Board of Nursing, time has elapsed. And KenyanNurse is here to cut down all those time that you waste as you are waiting to be sponsored, as you are waiting to be directed, as you are waiting to be guided. And we are doing that and reduce that process to actually 6 months. And as you are doing the 6 months, you are at the same time under the guidance and the leadership of Professor Regina with NCLEX training. She's giving the tips, the skills, the techniques on how you can actually find this NCLEX to be as easy as possible. And she's done so for several years. So many answers have passed in her hands, and they have passed on their first attempt. At 85 questions, your computer actually gives you a signal that this comes to your end. And at the end of 24 hours, 36 hours, you get an email, you are a USRN. And that's what we are all looking for. How else? These agencies are making you slow in the process. And if you are among those agencies, you'll actually bear with me that these are the areas that these agencies are responsible. And as KenyanNurse, we want to do away with those delays. When you come to us, immediately we start your process. By the time 6 months has elapsed, you are a USRN ready to move to the next phase, which Prof is here to share with you some good news, how she's prepared to ensure that your next phase is also not a gambling, but everything is laid out for you. The other part that you notice that these agencies are going to delay you is before they pay for your NCLEX exam, they might put you on hold for 4 months, for 6 months, because they're trying to prioritize candidates. But with us, whenever you are ready to be booked for the exam, even if it's Sunday, we're going to book you the exam. Even if it's Monday, we're going to book you the exam, because you have the control, you have power within you. We are only here to guide you, to be consulted by you. You are the boss. It means you dictate the terms. It means you are the one who dictates the pace. No one is actually going to slow you at any point. And with this, we've seen so many nurses passing their NCLEX within 4 to 6 months. Most of them 4 months, but some will have 5 months, few 6 months. And that is why we are here to declare that if you're starting today, you are going to be a USRN in the next 6 months. And in doing so, we are here to take that power to you. And with the USRN, you'll actually have the power now to choose your employer. So KenyanNurse, together with ReMar NCLEX Review, that is Professor Regina, we're here to crash all those times, all those months down that we have been actually handed over by those agencies. Before you even reach to the visa screening, which relocation will apply, you've been delayed for 2 months. Why should you have that delay? For us, we are reducing those 2 months, we are reducing those 2 years to actually only 4 to 6 months, so that you are able to become a USRN. Now, what's the difference between the KenyanNurse partnership with Professor Regina and other agencies? Let's go through them one by one. KenyanNurse, we actually process your journey immediately you reach out to us, while other agencies will actually take time to review your application between 6 to 10 months before you commence the process. You do not actually need any, you do not have to have any contract with us for any terms and condition, but with the other agencies, you must sign a contract with them. So with us, you come to us, you get given information, you consult, whether you're from Kenya, Uganda, Nigeria. My team has been on the deck to ensure that any client, any nurse from any part of Africa is actually provided with the correct information. So consultation is free. Once you actually make your decision, you commence your process immediately. And with that, you are able to chase your 6 months. With KenyanNurse, you realize that you do not have to have actually any English proficiency exam, IELTS, OET, TOEFL, to commence your process. We actually discourage that, because we know these English proficiency exams will expire within 2 years. For us, we want you to focus on NCLEX, to focus on Professor Regina, be able to become a USRN before you think about anything else. And The difference is, you notice with other agencies, they might require to have that IELTS exam, which later on, because of their delays, is going to expire. But with us, there's nothing you're going to waste in terms of your coin, in terms of your time, because we've structured everything as per the specific requirement as per that stage. We do understand that you do not need IELTS for you to sit for the NCLEX exam, so we do not request for it. Notice another difference is, for us, we do not care about your experience. While other agencies should ask you to have 6 months of experience, 2 years of experience, 4 years of experience. For us, you have a license from Nursing and Midwifery Council of Nigeria? Yes, tick. If you have a passport, if you don't have, can you process the passport? Once you have the passport, you have the license. We commence your process with CTFNS. And even with NCLEX, you don't need to have a license. You don't have to have a passport. With NCLEX, you can start immediately. You're done with your schooling, nursing schooling. As you're processing your license, you're learning NCLEX, you're learning techniques from Professor Regina. Even some students who are in their final years, their 4th years, their 3rd years, they are able to start their journey of knowledge acquiring from Professor Regina when they are still students. So we do not demand for any experience from you, because at this time, we understand that NCLEX is an exam for newly qualified nurses who do not have experience. So if you are somewhere there, either in Liberia, either in Nigeria, and you feel like you need to start, don't be stopped by all these obstacles. We are here to make it actually accessible to you. We are here to make it actually you taking up the power, you controlling the pace, you ensuring that you actually walk the journey, besides us guiding you, with Professor Regina actually mentoring you to pass this exam. And last but not least is, we do not request for bed capacity. Some agencies will request you to have 50, 100, and so forth, and even 200, as we don't really need those bed capacity, because bed capacity is not required for NCLEX. Bed capacity is not required for you to actually register CTFNS. Bed capacity is not required for you to do State Board of Nursing registration. And that is how we've demystified this information to make it simple, easy for you, so that you have the control, so that you are able to do it without any fear, without being scared, without being made to think that this is not for me, this is for other people. No, this process is for you, because we are here to bring it in your home, to ensure that you are able to actually become a USRN within 6 months. And you'll be able, with Kenyan Nurse in partnership with Professor Regina, you'll be able to become a USRN in 6 months. And I want to be candid with nurses. If you are processing a process that takes 2 months, 6 months, you spend less, because you are able to focus on this process to become a USRN within a shortest period of time and move on to other things. Unlike when you're processing with other agencies, 2 years, 3 years, it's time consuming. It means you can also not focus on other things. Your life stops just because you're on this process. No, for us, we want you to only focus on it within 6 months. You're done with it, you forgot about it, you move to other things, because life has to move on. You can't say you're going to have your life on standstill for 2 years, for 3 years. No. That is where we are also costing a lot of money. It costs a lot of money having that period. And if you sit down and do calculation, you realize it's so cheaper, faster, efficient to process through Kenyan Nurse in partnership with Professor Regina. Actually, more than even, it's so cheaper as compared to even those agents that are sponsoring you. Because the time you waste is so costly. And you know, if you're going to US, my friends, everything is in time. Everything is in time. Direction is in time. Distance is in time. Everything counted in time. And that is why they understand the value of time is money. So the time you waste, you've wasted a lot of time. And we are here to reduce that cost. Can I simplify on how the road is going to look like? If you are able to look at the screen, if you come to us today, for example, we are going to have an intake that is going to commence from Monday. We are now able to take nurses. We have the capacity now to take nurses every Monday. If you come to us every Monday, we're having new intakes, new nurses getting enrolled to virtual training system, starting the training. Nurses worldwide are now starting their training every Monday, whether they are from Nigeria, whether from Ghana, they are commencing every Monday. So if you actually join us tomorrow, that's Monday, you'll be in phase 1. And you'll be doing NCLEX training, none other than by Professor Regina, who is number 1 NCLEX trainer. And as you commence your training under her, you will now be taken up by KenyanNurse Consultant Limited to direct you to the next phase immediately. That is phase 2. So phase 2 is going to take you like 2 months. That is CTFNS registration, account management, until you have your SES report. And we're going to ensure that we follow up completely. If you're in Kenya, we are able to do your KMTC verification, nursing school verification, nursing council of Kenya verification, and we are able to dispatch all your letters from Kenya to the US, Pennsylvania, and any other state that that regulatory body is. So that is phase 2, CTFNS, until you get your SES report. It takes 2 months. And once you have your SES report, we commence to phase 3, which is State Board of Nursing documentation registration, until you get what we call authorization to test the exam. Which exam? NCLEX exam. That also takes you 2 months. Then once you have your HT from State Board of Nursing, you now move on to phase 4, which is NCLEX exam booking through Pearson VUE system. And we have an exam center in Kenya, and we are welcoming. At this point, allow me to be patriotic. I want to welcome all friends, all nurses from all parts of Africa. We have an exam center in Kenya. Come to us. We have an office in the same building that hosts NCLEX Exam Center. Once you come there, we'll be able to give you coffee, tea, water as you settle in, as you actually wait for your exam tomorrow. I want to welcome everyone to our office, and we are going to make sure that you are more relaxed to face the exam. And we can also be able to help you with processing all the process until you've actually traveled from whichever country you're coming from to Kenya. And this process, we are able to help you, guide you, work with you together with Professor Regina. We are doing alone. We have partners who are so much passionate about your journey, and they are ensuring that your journey is safe, is fast, efficient, and is cost effective. So affordable. I've never seen any other person training NCLEX at the same fee that Professor Regina is actually offering. And that was based on the request and the desire she has for African nurses. The power she wants us to have is what actually drove her to ensure that she makes it accessible, affordable. And this journey is for you, as it's for me. And because we are working together, I've walked the overseas journey. I've done all this process. I know how it feels. That is the reason why we had to build KenyanNurse, to ensure that it works with these nurses, that they do not work alone. And we've looked for partners who are so passionate, who have the heart of the nurse, who are themselves nurses, to ensure that they also work besides you. And it's only you to make a decision. If you've been joining us, if this is the first time you're joining us, this is your day. You never know when your blessing was to come. And this is your blessing day, so that we are able to come back after 6 months and you tell us you're a USRN. And that will be our joy. And I know Professor Regina, whatever she'll be clapping for everyone, as she always does. So this is your process. Start today. The other way I can explain, if you can look through the screen, you'll notice that we have actually compartmentalize them into months. The first month, you're joining the first step is NCLEX training. It takes you, by the second month, you're done with CTFNS. By the 4th month, you're done with State Board of Nursing. By the 6th month, you're done with Pearson VUE exam is booked. And that is for those candidates who are saving money. I can assure you that for those candidates who have all the money, we are able even to process within 4 months. How? We give you 4 months to do NCLEX training under Professor Regina. Us behind the scene, we are able, if you never know, you are able to register, you create CTFNS account at the same time with State Board of Nursing, at the same time with the Pearson VUE. As KenyanNurse, we are able to do so that when the SES report is out, immediately the report is communicated and transferred to State Board of Nursing. The same time State Board of Nursing releases the ATT, the same communication is passed over to Pearson VUE, and that by that time, we reduce the 2 months that is spent on CTFNS, State Board of Nursing, and Pearson VUE exam booking to actually 2 months. And with that, within those 4 months, you'll be preparing NCLEX, and you'll be going towards your success rate. And behind you, we are doing the job to ensure that every document is in place. SES report in place. ATT from State Board of Nursing that you've selected is in place. ATT from Pearson VUE is in place. The exam room, booked. The venue, booked. If you need accommodation, we are also able to make it possible for you. So that you just come in, you go to exam room, you come out, and we clap for you. We are waiting for you so that we can make it possible for you. So at this point, before I bring in to Professor Regina, we prepare nurses, and nurses are categorized in different countries. We have certificate nurses. In Kenya, we call them enrolled nurses. In Uganda, we also call them enrolled nurses. So for enrolled nurses, they are to sit for NCLEX for practical nurses. And they have opportunities in Canada, I mean, in Australia, in US, not Australia. And if you are a registered nurse, either diploma level, degree level, you are supposed to do NCLEX RN. And with NCLEX RN, you can practice in Canada, US, and Australia. The beauty of it all is Professor Regina, under this training, she prepares both enrolled nurses and registered nurses. So she does training for NCLEX RN and NCLEX PN, which is NCLEX for practical nurse. And the way she splits the difference, you really enjoy. You can actually truly tell what are the responsibilities, the duties of a licensed practical nurse. How are they different from a registered nurse? So if you are out there, you are an enrolled nurse, remember, it's not only for registered nurse, it's also for you, because Professor Regina has set up a system that actually accommodates everyone. Wherever you are, you need to consider starting this journey. And with her training, she does not only give you the training, she gives you variety of resources. She'll give you the training, she'll be available, like today, she's actually available to prepare us on how to critically think when we are in that exam room. After 2 weeks, she'll be again available to prepare us another topic, the way she did last month. And in her system, the virtual training system, she has lots of questions that are quite simulated like true NCLEX questions. So if you go through those questions, you go to an exam room, they're quite identical, similar in terms of setting, in terms of design, and everything, giving you the real NCLEX exam room experience. And in addition to those questions, she also has prepared books, summarized. I know, as a nurse, I've read, Bruno and Sudat, I've read and went through Maths for Midwifery, for midwives. I've gone through Pasafanda. All those are heavy books. It can take you months to go through them. She has done that job for you. She's summarized the content to suit NCLEX, to actually direct you towards specific questions, specific areas that are majorly set in NCLEX. And she's prepared her 2 books. The first one is Quick Facts, and the virtual training system, the book that guides you on how you use the virtual training system. And these books, fortunately enough, she's actually offered them to you. They're in our offices in Kenya, and we are able to dispatch them to Nigeria, to Ghana, to Liberia, Sierra Leone, whichever country you are in. Just reach out to us through an email, which is actually on the screen. That is customerservice@kenyannurse.com. And if you are able to WhatsApp us, you can WhatsApp on +254 716 192. And you'll be able to get these books. You'll be able to be admitted in the virtual training system and be able to actually access all these resources. You access her training, access her questions, access her books, and all the supports that she's giving you at affordable price that is only meant for African nurses. And that is $169. If you're in Kenyan shillings, we are able to translate it into Kenya shillings. If you're in Uganda, we are able to translate in Ugandan shillings and so forth. And we are opening up several spaces so that we can be able to make sure that we are able to translate to your level, to your language, to your level of country. And we look forward to actually access more countries so that we can make it more accessible. So if you're outside there, you need to join the NCLEX and become a USRN in the next 6 months. This is the time. This is your time. This is your space. Professor Gina is your blessing that you've been waiting for. Have you ever had a prayer that you feel has been answered? I can truly tell you, as Kenyans, Professor Gina was our answered prayer. And to you now today, Professor Regina is your answered prayer. The partnership between KenyanNurse and Professor Regina is an answered prayer that you've been waiting for. The wish that you've been having, the answer is today. Commence today. In the next 6 months, you need to come back and say thank you and say you are a USRN. And Professor Regina will not stop there. She's not stopped there. Passionate about nurses from Africa. She has something else so great waiting for you. So when you become a USRN, you're not going to go anywhere else. We are here in this one house because every resources is with us here. And that is the beauty of you working with us. You have everything under one roof. And she's waiting for you in the US to welcome you, take you around for shopping, ensure that you feel the warmth that she always feels when she comes to Kenya, when she actually goes to Nigeria. So you're planning to do so. When she goes to Ghana, Uganda, and so forth. And for those who are in United Kingdom, that is my second home. We are coming. By June, Professor Dina is coming to London. He's coming to Birmingham. He's coming to Manchester. He's coming to Scotland. He's coming to Cardiff. He's actually coming to Northern Ireland. And I'm sure she's going to enjoy. So welcome her in the UK by June. Ensure you actually schedule yourself. You do away with every other activity so that you make yourself available for events. And for Uganda, we are coming. We shall communicate the dates. For Nigeria, we are coming. I know you've been waiting for her. I'm going to bring her to Nigeria. Ghana, we are doing so. So for that, can I welcome everyone from any part of Africa? I know she plans to come, but today she's here with us to share with us her knowledge, her inspiration, her skills, her techniques, her experts on how we can actually approach NCLEX question as nurses from Africa. Our context is different because our training is different. We just need that switch a little bit and it becomes so easy. And that switch is what she's here with us to share with us. Prof, without wasting much time, I want to welcome you. And I do believe as African nurses, we actually always waiting for you. As we are here, we are waiting for your knowledge, for your expertise, for your skills, for your techniques, because we all want to be USRN. Thank you so much.
Thank you so much, Paul Simi. You are in, and I hope you didn't miss what he said. Kenyan nurse consultants, these are the best people to trust your US journey to. Their process, what I love about them is that their process is so transparent. They tell you exactly what's going to happen. They let you know from the beginning what the end will be and the role you will play, which is controlling. Other agencies, like he said, they hide their hands. They make you sign a contract. They don't tell you that it could be 2 years or 4 years or where you are in the lineup. And what we're bringing to you is the opportunity to take control of your own journey, to take control of your own success, because nobody's going to hand you the life that you dreamed of. You will be waiting for somebody to give you your dreams, and that's not a great position to be in. So thank you, Paul, so much. And we look forward to hearing more about how Kenyan nurse consultants can help, how quickly they can help, and how through our partnership we make it happen in 6 months. I mean, 6 months. That was his goal. I don't even know how he did it. I don't even know, but that's him being an expert, a master at what he does. You're able to save time and save money. So thank you so much. Transparency is key. Yes, it's key. So let's get into our topic. We'll talk to Paul a little bit later, but feel free to continue to ask your questions. We have Team ReMar in the chat to help facilitate all of your questions on today. All right, we're going to get into critical thinking. Everyone, get out your notebooks. This is so important for anyone who is preparing for the licensure examination, because how you critically think and how you understand critical thinking will be the determination of whether you get that nursing license or not. A nursing license in the United States is not given, it is earned. It is earned. And so we're going to just take it step by step, okay? Because this is a very advanced topic. There are multiple approaches to this, but we're going to start by just having you to evaluate where your critical thinking is today. And we'll continue on this. So let's just define critical thinking, because when you are critically thinking about something, it's not the same as when you are going about your day. It's not the same as when you're deciding, where your next vacation is going to be or what subjects you're going to enjoy studying. Critical thinking is different. So I have here the definition. Critical thinking in nursing means making safe, sound decisions under pressure. Okay, did you catch that? You might have missed it. It's about prioritizing, analyzing, and applying knowledge, not just memorizing facts. And this is where a lot of international nurses miss the mark, because NCLEX is not just about how much you can memorize. It's not just about how much you can read. It's not about how long you have been studying or how many questions you do. Okay. Critical thinking is about questioning everything that's put in front of you. Did you catch that? Critical thinking is not about memorizing, it's about questioning, right? And so instead of finding the right answer, it's about asking the right question. NCLEX, we know, is a time-sensitive exam. So the questions that you are asking yourself, they have to be quick. And that is where the content matters. That is why we study content, because the content helps us to analyze what's put in front of us. A lot of nurses make the mistake that critical thinking is about some future event. No, critical thinking is about what NCLEX puts in front of you right now, how you ask the questions, right? The major questions that you're asking with critical thinking are going to be, how is it? What happens because of it? What do I need to do right now? Okay, those are the types of questions you ask yourself. For example, let's try this one. Everybody get ready to comment. I want to see the answers in the comments. I want to see where you are in your critical thinking, and particularly critical thinking under pressure. Here's the question for you. A post-op client suddenly becomes pale, diaphoretic, and reports feeling like something is very wrong. What should the nurse do? Number one, check the vital signs. 2, call the healthcare provider. What is the correct answer here? This is critical thinking. Critical thinking. We are warming you up to it. Okay. You guys know I like to cook, right? So I like to cook you up, all right, in terms of pressing you. All right. But we start with very foundational questions. Okay. I have a group of nurses. There's over 250 nurses here. I want to see massive comments. I want to see 250 answers, 280 answers in the comment screen. A lot of the times we show up for something, but we don't give it 100%. I'm asking you to give me 110% during this class. There is nowhere else on the planet that a free critical thinking class for international nurses who are taking NCLEX is happening. I want y'all to show up like this is important to you. Okay, correct answer is number 1, checking the vital signs. That is going to be the correct answer if you're taking NCLEX every single time you're put in this situation. And remember, the priority is situational. You're not going to call the doctor, because what is the doctor going to ask you? When you call the doctor and you say, Mr. Smith is in his room and he's sweating. What's the question? Put it in the comment. The doctor is going to ask. And he feels like something is very wrong. What's the doctor going to ask you? Doctor's going to say, okay, nurse, you're calling me, giving me an update on a patient. Did you check the vital signs? What's his blood pressure? What's his temperature? What's his respirations? And if you're on the phone as an international nurse and you have not checked the vital signs, you're going to have to say, "Oh, I didn't check the vital signs. Hold on. Let me go check the vital signs." And you're going to put that doctor on hold, that very busy doctor, and you're going to run off and check the vital signs. No. And all the other nurses there will laugh at you because you made that mistake. And they'll say, "What did you see? She didn't even check the vital signs. She called the doctor," right? He didn't even check the vital signs. So we have to make sure that we are always ready to be independent in our practitioner self, right? Okay. So number one, check the vital signs. If you don't have a notebook, if you're not taking notes in this class, you're missing out. If you have not shared this video, you're missing out, because there are many people who should be here that are not here. And it's because they don't know. They don't know. So let's tell them, all right? Okay. Why does the NCLEX, okay? Why does the NCLEX test for critical thinking? Because nurses previously were getting licenses. Okay. And I have to talk about international nurses because that's who I'm speaking to. International nurses, they were getting licensed and then they were coming and they were taking jobs and they were not successful in their jobs. The reason why they were not successful in their jobs is because the pace of the real environment of nursing is much different than when you're reading it out of a book. And your responsibilities in the United States as a nurse are very high. Patients' lives depend on what you decide or what you don't decide to do. Okay. And so these questions are they're challenging, but they're very routine. If we're talking about critical thinking for the NCLEX, the way the board writes them, they're structured to test what? Prioritization, delegation, intervention. Those are the main critical thinking questions. Everything else is content-based. Everything else is quick facts. It's in the V2, it's in the lectures, right? But the critical thinking are going to focus on these topics. And so you have to be able to apply your knowledge to these case studies. And that's why I tell you, get into the V2 Q bank, because that's where you're working out whether you can critically think or not. So the types of questions that I'm going to be challenging you with when you come to my classes, when you're in the V2, who do you see first? That's a priority question. Who can the nurse delegate to? In international nurses, we do things a little differently. We have nurses' aides in the hospitals. Do you have nurses' aides? I believe you do. We have licensed practical nurses. We have registered nurses. All of these positions carry a specific nursing duty. And you want to make sure that you're not cross-mixing who can do what. So we need to focus on delegation. All right, which action is correct? That's medication, that's safety. What's the medication to give? What's the safety approach? And then also prioritization, but differently, what would you do next? And so these are the most challenging when it comes to critical thinking. I know that I can definitely tell who's going to pass NCLEX, who's not going to pass NCLEX based off this. Let me define what is not critical thinking. because this is just as important. Critical thinking. This is a myth, okay? Critical thinking means that you know all the answers. Oh my goodness. We have to stop this. You don't have to be perfect, okay? You do not have to be perfect in order to pass NCLEX. You don't have to be perfect, but you do have to be prepared. That means that you are able to make the best decision, okay? And the way you make a best decision is because you've been practiced, you've been prepared, not perfect. It's not about you just memorizing a whole bunch of rationales. Oh, please, 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 please. It's not about you doing 100 questions a day. In 2025, in the year of our Lord, 2025, can we stop thinking that we have to do 100 questions a day, or we have to do CAT exam after CAT exam after CAT exam after CAT exam? Those things will not get you the license. But this hard work that we're doing now, that's what needs to be your process. Okay. Critical thinking is not too. This is another myth. Another myth. The doctors make all the decisions, so nurses just follow orders. In the United States, nurses are independent decision makers. And so if an order comes across your electronic charting and it is a dangerous order and you just carry it out, you're going to cause a patient to have an event. Okay, it could be a sentinel event where the patient dies. They could have some sort of medication reaction. Anyways, let me say this. Let me be clear. In the United States, nurses are going to jail now because they are not critical thinking. And what did I tell you critical thinking is? Critical thinking simply means that you are questioning the things that are put in front of you. That's critical thinking. It's not about having the answers at all. It's about if NCLEX puts a scenario in front of you, if a doctor puts an order in front of you, you're asking the questions. How is this done? What if I don't do it? Right? What happens if I do it? What happens if I don't do it? Right? You're questioning everything. We do so much of that throughout the year. 7 days of NCLEX, Christmas stuff. We're critically thinking. Love your content. Mondays and Wednesdays. We're constantly questioning what's in front of us. And that's the work. That's the other part of the work that you must do. You have to catch an error by a doctor, by a respiratory therapist, by a pharmacist. And that's why nurses are paid so much money. That's why we're paid so much money, because we have such a high level of responsibility. And I don't know how it is in your country, but in this country, you are paid according to the problem that you solve. Okay? And that's it. And you can be the hardest worker, and you can be, the most faithful, dedicated worker. But if you're working on small problems, small tasks, you're going to get paid a small amount. So when we talk about saving lives, when we talk about understanding medications, that's a big problem. So nurses are paid according to the problems that they solve. All right. And that's the goal of coming to the United States. All right. Another thing critical thinking is this idea that there's only one answer that is correct on NCLEX. I don't care what other tests you have taken, there's probably going to be one answer that's right. But when you get to the NCLEX, when you get to this test here, that's the game changer. On the NCLEX exam, there's often multiple correct answers. So it's not about that. It's about what's the best choice for the situation. Oh, don't miss it. Don't miss it, because you can waste a lot of time. And this is where people develop the habit of second guessing. They second guess because they think, no, this one is right. No, this one is right. Okay, let's start here. They're both right. They're both right. So, which one is the priority? Which one is most appropriate? What's the best choice out of the things that are right? You know? All right. And so, again, this comes by not by having all the answers, but having the questions. The questions. Here we go. Let's try this one. Let's try this one. Get ready to comment. I'm going to read it. I want to see your answer. You are assigned 4 clients. Who do you see first? Number 1, a client with COPD on 2 liters of oxygen and reports mild shortness of breath. 2, a client post-op 6 hours ago with a blood pressure of 88 over 55 and a heart rate of 120 beats per minute. 3, a client with pneumonia requesting pain medication for chest discomfort. Or 4, a client with nausea who is not voided in 6 hours. Who is your priority patient here? Comments on the screen. Great job showing up. You guys are showing up today. I know this is a pop-up class in terms of usually I go live on Mondays and Wednesdays, but that's why it's so important to follow me so that you know when our critical thinking classes are, our international classes are, you know, our Safe Nurse Now jobs are, all those things. Tap into it, okay? Correct answer here. How did you do? Let me know if you got this one right. Correct answer, and this again is critical thinking. 2. 2 is the right answer. This patient has the majority of the issues going on right now. Okay? This patient has the most issues. Look, people were between 1 and 2, it seems like. So 1 has COPD and they're reporting mild shortness of breath. Is this patient somebody you want to see? Yes, absolutely. You want to see this patient. But is this the priority patient? Is this the person we want to see first? No. Why? Because 2 is a post-op patient. Okay. 2 has a low blood pressure and a high heart rate. This person has 3 issues going on. This is our priority patient. We got to be able to identify it. Okay. And again, this is why I tell you to, when I go live, come to class, because what I need to do is be able to help you overcome the strategies. Oh, there's one thing I cannot stand, and that is somebody saying, I have all the strategies to pass NCLEX. Can't pass NCLEX with strategies. They don't work. Okay. They don't work. They're good for low level thinking. They're good for low level critical thinking, airway, breathing, circulation, ABCs. That's a strategy. And so people feel like, oh, when I master this strategy, airway, breathing, circulation, I'm good for prioritization. But how many nurses know that it's not always an airway problem that's the priority? For example, this situation, if you just went ABCs, you would get it wrong. Okay. In this situation, circulation is the priority, not the airway. So you have to be so careful. Let me tell you this. Be so careful who you take advice from. Okay. 2 is the priority. All right. How about this? I told you that there are many ways that we can critically think. This is another way. Delegation. Delegation is a critical thinking scenario. So what about this? Which task can be delegated to the LPN? What are you going to say? Is it number 1, reminding a patient to take his own blood sugar? Or 2, instructing a stable client on how to change a bandage? If you were taking NCLEX and this was put in front of you, which one are you going to go with? All right. I have some, I've split the crowd up. Okay. And this is how I'm able to write different levels of questions for NCLEX. I can start you off at the very basics. Can you recognize? Okay. Can you memorize? I know most of you can do that. But now we're at, can you question? Can you analyze? Correct answer here. I see the comments. Correct answer is number 1. Okay. Correct answer is number 1. An LPN can remind a patient to take his own blood sugar. And so what I'm doing is I'm using different language, but I'm saying the same things. We know that LPNs can remind patients who've been previously taught a task. So it's the patient that's doing their own blood sugar here. But we do know that LPNs cannot do initial teaching. So you have to be careful, because what I did is I put a distractor in number 2. And a lot of you fell for the distractor. I added the word what? I added the word stable. And usually stable and practical nurses paired together. And so if you're just going by memorization, if you're just going by strategy, you will look at that and you will say, that's okay, because it's a stable patient. But you haven't asked the critical thinking question, what happens? Okay, we're talking about instructing a patient. Can't do that. All right, I'm moving on. I can't stay here. What about this one? Here we go. A post-op client, we're talking critical thinking. A post-op client is requesting pain medication. Which is the priority action of the nurse? All right. Number 1, look to see when the last dose was given. 2, reposition the client. 3, providing an ice pack. Or 4, notifying the healthcare provider. Remember, what did I tell you? How are we doing these questions? How are we approaching? You have a post-op client and they're requesting pain medication. Great job. Number 1, see when that last dose was given. That's the most important thing to do at this time. Before doing anything else, we got to see when the last dose was given. Be very careful. Be very careful if you picked anything else. Okay. Remember, calling the doctor rarely going to be the right answer for NCLEX. Rarely. There's always something the nurse can do. Okay, I'm moving on. What about this one? Let's take our time here. Here we go. 45-year-old confused patient arrives at a rural clinic with a high fever, heart rate of 130, blood pressure 90/50. The clinic has limited IV fluids, no access to blood cultures or IV antibiotics. What is the nurse's priority action here? Number 1, administer oral antibiotics and prepare to transfer to a high-level facility. 2, initiate IV fluids, apply oxygen, monitor vital signs closely. 3, obtain blood cultures before giving any antibiotics. Or 4, assess for signs of localized infection before determining further treatment. Okay, so what I've done here is I've removed you from a hospital environment. What do we know about rural clinics? What do we know about alternate settings? Okay, this is what I'm cooking now, right? Now we're talking about something different. I'm challenging you to critically think now, because most of you've never been in a rural clinic in the United States. What are you going to do? Okay? Because your nursing priorities don't change. Do you understand? Like, your nursing care does not change. You have enough information to pick the right answer. The right answer is what? 2. The right answer is 2. This patient is coming in with signs of what? Sepsis. You have high fever, Your blood pressure is dropping, your heart rate's up. 130 is high no matter where you are. If you're in the field, if you're in the hospital, if you're in a garage, if you're in the shopping center. Okay? So we have to use what we know in our nursing practice to treat this patient. We got to go more into this. I can tell right now. This is going to be a good one. All right. Let's do something else. I'm moving on. Most of you guys you struggled with that one. Let's try this one. A patient arrives at a disaster relief camp with a deep laceration on their leg, sustained 24 hours ago. The wound is red, is swollen, is oozing pus. The patient now has a fever of 102, 38.9 Celsius. Temperatures, okay? Chills, and a heart rate of 118 beats per minute. What's the priority nursing action? You're in a disaster relief camp. Number 1, request imaging of the leg and monitor the wound closely. 2, apply a clean dressing, encourage hydration, and monitor the patient. 3, perform wound irrigation, remove necrotic tissue, and elevate the leg. 4, start oral antibiotics, give fluids, and arrange for urgent evacuation. What's your priority action here? Okay. And these are the case. I got this from the V2. These are the case studies. These are the scenarios that if you're not studying with me in V2, you're missing out on. These are the scenarios that if you are not taking steps to actively expose yourself to this, you're not doing yourself any favors. Okay? Correct answer. I see a lot of 2s. I see a lot of 4s. We're between 2 and 4 here. Correct answer. If you picked 4, you got it right. Okay? If you picked 4, you got this one right. And again, it goes back to what you're given and what you have the capacity to do. And as a nurse, that's not changing. Let me go back here. Okay. For those of you who picked number 2, this is what you chose to do. You chose to, a patient has, obviously they have an infection of a wound. You chose to apply a clean dressing on that wound. Encourage the patient to just hydrate, drink fluids, and you're going to wait around for that patient to die because that's what's going to happen. Okay? So let me see if I can put it in terms of what actually is going on in scenario 2, because I never want you to pick that again. I want you to be asking yourself as part of critical thinking, what's the question I said? What happens if I actually do this? Literally ask yourself, what happens if I actually do this? Okay? 4 makes much more sense. Starting antibiotics, giving fluids, getting the patient out of there. The disaster relief camp is not the place the patient needs to be. All right. So critical thinking for international nurses, you guys have to do this. You have to be able to prioritize the immediate threats. The things that are in front of you, no matter how much information that you're given, you have to be able to recognize what's the priority. And what makes it challenging is when I begin to stack assessments on top of each other. Then you get lost in the priority. Also understanding, and this is the international struggle, understanding what is available to you in different scenarios. Okay? When the NCLEX says you're in a rural clinic, that means something. When you're in the ICU, that means something. So you have to be able to adapt and improvise. All right? Anytime you're out of the hospital, you're not going to have imaging. You're not going to have IV antibiotics. You won't have emergency care, but you will have your nursing knowledge. And also, you got to know when to stabilize somebody and when to transfer somebody. And that's part of disaster management. Okay. So, like I told you, critical thinking, this is a subject that has many layers on it, but you must be willing to study it. You must be willing to adapt. All right. And that's your level of thinking. You have to be able to adapt to this style. All right. NCLEX is not just about knowledge. It's about applying what you know. Okay, it's about applying what you know. You have to be able to think critically, stay calm, and focus on patient safety. And what I told you this earlier. You don't need to be competent. I'm sorry, you don't need to be perfect. All right. Are you tracking with me? You don't need to be perfect. You just need to be competent. And that's our goal. That's our entire goal for you. And so this is my final thoughts, because I'm going to wrap this class up. In the V2, the work that we are doing in the V2 is helping you to build your capacity to critically think. And that starts by having a strong content knowledge. That's where it starts. Okay? Because if you don't know what you are capable of, if you don't know your role in nursing, if you don't know the role of the people working with you, you will not be able to critically think. Okay? And so particularly for international nurses, and this is why my partnership with Paul Simiyu RN and Kenyan Nurse Consultants is so powerful, is because we know that if we can get you the information, whether it's passing NCLEX, whether it's coming to the United States, you can make better decisions and you can make those decisions faster. But if you have to go out and find the information, it's going to take you a lot longer. Okay. If you have to go out and do a search and play games and go back and forth with companies, right? It's going to take you a lot longer and it's going to cost you a lot more money. So this is a one-stop shop for a nurse from Africa, a nurse from the UK, this is a one-stop shop for an international nurse who wants to come to the United States and be a registered nurse here. Okay. And these are the things that we are trying to help you to see that you have to have in the front of your mind. Everybody right here, and this is particular for international nurses, you're in a comfort zone of the way you've been trained, of your home, of your food, of the weather. And so if you're going to come to the United States, you have to be willing to get uncomfortable so that you can adapt. Right? And so we want to help you with that process, because it's so good. I mean, it really is. It's amazing to be a nurse in the United States. And if you watch me, you watch my life, you see what I'm able to do. It is absolutely because I have a nursing license. That's it. So I'm able to travel. I'm able to live my life the way I want to. I have freedom. I have time with my kids. I'm able to homeschool my kids, all those things because I'm a USRN. That's it. Right? And so whatever dream you have, this is the vehicle that you're going to get to that dream, because nothing else, I'm so confident to say this, nothing else can change your life like being a nurse in the United States. Right? And so you have to prioritize this journey and not let other things distract you from it. Because it's not only going to change your life, that's the thing, it'll change the life of your children, it'll change the life of your parents, and it will just reach out, right? And what we really want is for you to be able to change the life of the people in your country who don't have the privilege of coming to the US like you do. All right, okay, that's it. But in order for you to do that, I'm going to bring back in Paul Simiyu RN, because he has walked the walk. And he's going to tell you again, for those of you who came late, you wanted a recap of what this is and how to get there. This is it. So let's welcome back Paul Simiyu RN. Everyone, give it up for him. He is the master behind making this journey a 6-month journey for you. So welcome, Paul.
Thank you so much, bro, for the great lesson. I've also learned so much how to apply the knowledge I've acquired all this time and demonstrate my competency, and also be able to be safe. The patient I'm caring for has to be safe. As you always emphasize, NCLEX is about patient safety. In whatever you're doing, you have to ask yourself, how safe is my patient? So
Oh,
I know these questions are numerous in NCLEX and they are really quite easy but doable. And thank you so much for the techniques for experts and for also the skill that you've bestowed on us. And as a nurse outside there who is looking forward to have this competence, to have this safety, this is your room, this is your home, this is where you belong. And if there is that prayer you've been requesting to have it answered, it has been answered. How do you start? We're here to work with you together with Professor Regina. Professor Regina will be handling the knowledge, the skill, the critical thinking. And for me, with KenyanNurse Consultant Limited, is to ensure that you are safe in this channel. You are fast and you're saving on costs. So we've partnered with Professor Regina with the ReMar NCLEX review to provide the nurse from Kenya, Uganda, Ghana, Nigeria, Sierra Leone, Botswana, Ethiopia, Tanzania, without forgetting Rwanda, with a comprehensive resources and support system for you to prepare this NCLEX and be able to walk the journey and become a USRN in 6 months. Yes, I mean 6 months. And most people are even going beyond that and they're doing it in 4 months. It's doable because people have done it. Why not you? So we have presence in 3 countries as we speak, 2 continents. In 2 continents, we have a presence in the United Kingdom. If you are in the UK, you can be able to reach out to us on the WhatsApp number on the screen, which is +25416192248. And with that, we shall be able to reach out to you so that you start your journey. If you're in Uganda, we have an office in Kampala, and we shall be able to guide you from there. If you're in Kenya, we have 9 offices, that is in Eldoret, in the Anga building. In Nairobi, we are in Principal Place, the same building hosting NCLEX Exam Center. We are just opposite the VFS, that is the UK Visa Application Center. Once you come there, we'll be able to have time to share coffee with you, tea, and even water as you prepare to go in that exam room. We welcome each and every person. Come, we share coffee as you set in your exam room. In Mombasa, we are actually on Orendo building. We are also in Mombasa. You can come there and we'll be able to have some free consultation service, share coffee, and be able to make your journey quite easy and relaxing. We're also in Kisumu, Kisii, Nakuru, and also Kampala and actually UK, as I said. So we are also trying to make it accessible to all nurses in Africa, and we are looking forward to partner with various nursing schools so that these resources can now come close to you. As you had last time, maybe if you attended our earliest event, I was speaking from London. And today, I'm speaking from Nairobi, the capital city of Kenya. The reason why I'm in Nairobi is because I have various schools that we have scheduled meetings to be able to bring ReMar NCLEX in those schools. One of the top schools is Nairobi University. We have a date with them to ensure that we have this ReMar NCLEX close to the nurses. And if we have a nursing school in Uganda, Nigeria, Ghana, just email us on customer service at kenyanurse.com and we shall be able to reach out to you so that we bring Professor Regina to your home. And in doing so, we do understand that we're going to empower so many nurses. And join us in this journey. If you're a nurse who's already passed the NCLEX, we have good news for you. If you're a nurse who is about to start, we have intake that is ongoing, starting from tomorrow. If you email that is customer service at kenyanurse.com, we'll be able to give you the way forward on how you can start. You can also WhatsApp us. That is +254-716-192248. And we'll be able actually to commence your journey. And wherever you are, as I said earlier, Professor Regina has these books for you. We'll be able to dispatch those books to your residence, to your place of stay, and you'll be able to kickstart your journey. And we will make this process 6 months for you so that you focus on other things. And the next step is for those who have passed NCLEX, if I've seen people from Finland, from Philippines, from Nigeria, who have declared that they have passed NCLEX using B2 in ReMar. We also requesting you to share your email on customerservice@kenyannurse.com, and we'll be able to reach out to you because we have opportunities waiting for you. We've partnered with another great partner, that is SafeNurse, who is going to facilitate the availability of these jobs for you, and will be able to be in the US. Now we're living the real life, taking care of the real patient and making sure they are safe now. And with that, we have everything here for you. So email, that is customer service at KenyanNurse, or WhatsApp +254 716 192 248 if you need to start your NCLEX, and if you've already passed NCLEX and you're looking for opportunities for jobs, and these jobs are facilitated by none other than one of our great partners, that is SafeNurse, which we now bring three parties together. That is Kenyan Nurse Consultant Limited, to work with you the journey and make sure you are safe. Professor Regina, to ensure that yourself and your patients are safe. Pass the exam. SafeNurse now to ensure that you have a safe employer. So the journey is all about safety, all cautioned. The process is safe under Kenyan Nurse, the exam preparation, and ensuring that you are competent. Professor Regina, ensure you yourself, and the patient you're taking care of is safe. And SafeNurse comes in to ensure that the employer you get, the hospital you get, the place you work is safe for you and your family, because this is one of the safest places you can be. It's your home. You need to start today. At whichever stage you are in, if you need to start NCLEX, we have 150 slots that have been given to us by Professor Regina, which we are sharing amongst all of us in Africa. Reach out to us to that email, customerservice@kenyannurse.com. Get that slot before they actually run out, because they are so quickly running out. Don't wait for them to run out until we start requesting for more slots and so forth. No, these slots are yours. We are going to share equally in Africa and ensure that every nurse has a slot. Those of us who actually are enrolled nurses, they want also to become what we call licensed practical nurses. You are a certificate nurse and you want to be in the US, that dream is true. It's coming true, because you are going to do what we call NCLEX for practical nurses. And we've been given 75 slots. Why not that slot? One of them be yours, because this is your answered prayer. This is your day to start your dream. I remember some 6 years ago, I was also just in the street of Nairobi until I made that decision. And I can tell you, I do not regret. And I want everyone to enjoy. That's why I'm here sharing with you, telling you that let's do it, because I don't want to enjoy alone. I was just earning 50,000. And as we speak now, my salary is double, triple, times 10, 20 times those times. I'm telling you, I wish you had a chance to feel the difference in terms of my payslip. The power I have with my life is much better than what I had. With 50,000 in Kenya, the power I had to do things for my life was limited. But with the salary I'm earning now in overseas, I'm able to do lots of things. I'm able to travel. Just last week, I was in the UK. Yesterday, actually, I was in Western Kenya. Today, I was in Eldoret. And as we speak, I'm speaking from Nairobi. How is that possible? Because you have the power, you have the ability, you have the resources to ensure that you are able to do so. And we need everyone to have those resources, because you can. I was talking yesterday in our Eldoret office to a nurse that you don't need to be special. You don't need to be from a special family, from a special community. You just need to remember that you have a license. That license alone, wherever you are, is power in our hands. The difference is, how do you use that license? I know some people have been pressurized, oh, you need to look for another extra education, you need to go for a master's, you need to go for a PhD. Yeah, you need to do so. But that license alone has so much power for you. You need to utilize it. And how do you utilize it? by filling yourself in such forums, and that's the first step. The next step is by making the decisions to start. And if you're in Kenya, you want to start, you can start as we speak now. You just need to pay 25,000 through our pay bill. We don't receive money through any M-Pesa, through another means. Our official payment method is through our pay bill. That is 4084929. And the account number is your official names. If you can include RN, I'll be smiling because I know this is a proud nurse. Then, if you are from Uganda, you can pay us through Centenary Bank, through MTN mobile money to KenyanNurse Uganda in Centenary account. Just dial *165# and press OK. Then you choose option 6, which gives you financial services. After that, you choose option 1, which gives you bank deposit. Then you select option 1, Centenary Bank. And with that, you enter the KenyanNurse account number 3100101721 and enter the amount that is equivalent to 750 Ugandan shillings, and you'll be able to start your journey. Are you from overseas? That is United Kingdom, Nigeria, Ghana, and any other country that I've not listed in the payment method. You can also reach out to us through another payment method, which I'm going to share with you on the next screen. You just need to send us your official name and your email through this email, that is customerservice@kenyanurse.com, and we'll be able to give you the payment link, which you just click on it. Then you choose option 2, which is pay using the card. Option 1 is pay using the bank transfer. No, use the payment for card. With that, you'll be able actually to transmit your money and you'll be able to start your journey. And as we speak today is actually 2nd March. You actually add 6 months, that is by September, you'll be a USRN. The same September, you pass USRN, SafeNurse will be there for a job with you. As we speak now, we have slots, about 30 slots in Texas for HB1 visa. SafeNurse has those opportunities. So if you have passed NCLEX using VT or any other sources, you need to reach out to us through the same email, and you'll be able to be applied for HB1 visa. And with HB1 visa, based on the current rollout, it's going to be rolled out on 7th, and by 1st of October, you'll be in the US. A competent nurse, a safe nurse with a safe family. And with that, what else are you waiting for? This is your time, because this is your answered prayer. Whether you are a certificate nurse, whether you are a diploma nurse, degree nurse, whether you don't have experience, you don't have IELTS, you can start with us. We'll be able to work with you. Whether you pass NCLEX, we have a job for you. And the question is always, as Professor Regina was teaching, the question is this: why are you a safe nurse? And maybe allow me to take back to her so that she can tell us how we actually, are we a safe nurses, or we still need to do better, attend more sessions, go through V2 more times so that we become safe. Before we get that job with safe nurse. Thank you so much, Prof. And you're here.
So much. Thank you so much, Paul. And I hope you all now, as we come to the end of our class, I hope you see the amazing opportunity that is in front of you. Not only are we empowering you with the knowledge to take control of your journey to the US, to know when you're going to start and when you're going to finish right away, but we are also giving you the knowledge to get that nursing license. And then when you get that license, you have a partner, you have a friend, hello, that's me, already in the United States, welcoming you. And I'll tell you, it is so nice to have someone waiting for you when you come to a new country. That is what Paul and his team did for me when I brought myself and my little children to Kenya. It was a big step for me as a mother to bring my children to an unknown country. But because I had him waiting for me, and because I had him to put my kids in the car and take them safely to where we had to go, I felt so good about being there. And it helped our transition. We stayed there a month even. It helped our transition go off so well. And so we want to do the same thing to everybody that partners with ReMar and KenyanNurse. And when you come over through KenyanNurse, and when you get the job with Safe Nurse Now, which is our company that we partner with, and we get those jobs, we're going to be waiting for you. So just imagine that day. Imagine that day. So if you were a safe nurse today, you can be a safe nurse tomorrow with us as well. Thank you so much, everyone, for coming to our class. We will be doing this again, right, Paul? We're committed to being with you along the journey. Yeah.
We have another session. If you are preparing for the NCLEX exam, you can join us again. Let me just confirm the dates.
It's March 30th,
That
right?
is 16. If not 16, 23rd.
Is it 16? Let me see.
That should be 6th of April. We have another session.
Okay.
And with that session, Prof is coming with more nuggets so that we are more safe. And remember, the journey is you start with Prof Regina through phase 1 NCLEX training. You walk through the journey with Kenyan Nurse Consultant Limited. You're done with the exam yourself, and the company and the employer that gives you more jobs that are safe is also called Safe Nurse. So everything is nursing. You start with Kenyan Nurse, you work with ReMar Nurse, then you end up with Safe Nurse.
That's right.
You can imagine, covered by the blood of nursing. We are nurses, and nursing is our business, and we are here to ensure that we are all safe. So,
absolutely,
I've seen nurses from Nigeria. You can also email us, and we'll be able to send books to you. Come to Nigeria. Professor Regina must come to Nigeria. If you are a Nigerian nurse, you can clap wherever you are. My friends from Ethiopia, we are coming. From Ghana, we are coming. And before we come, send us an email, start your NCLEX training from tomorrow. The email is customerservice@kenyannurse.com.
Right down below. You can see it there. So thank you, everyone. We hope you have a good day, a good evening, wherever you are. We are here to support you on your journey. And so now we've done our part for today. We showed up for you. We had our team show up for you. So now it's your part to send that email, send that WhatsApp, get into your V2 to start studying, but make sure that you do not let this pass you by, this opportunity. So good evening, good evening, everyone. God bless you, and we'll see you later. Bye-bye.
Bye to everyone. Good night and good evening from whichever country you are from.